Hi guys, it's me, Jess. Some of you know me from the Judge Simpson's chat room. There's live videos. Some of you know me from Facebook or wherever. And I know this is a horrible camera angle. I know. But I want to start with, it's been a week from hell. Not this Sunday, the Sunday before. I was washing my dogs in the tub, and I was leaning over the edge of the tub to try to reach my dachshund's rear end because he was trying to be difficult. I know, surprising dachshund. And as I was leaning over the tub, I felt like a pop in my ribs, and I was like, okay, you understand this, right? So loosey-goosey joints, all that other stuff, my ribs slide in and out of place for no reason. So I was like, oh, look, I dislocated a rib, or it twisted, whatever. Sorry, new bottle of leave-in conditioner. So it hurt a little bit. I mean, but I sat up, and it felt like it, it went back. It was like, oh, okay, not that bad. So I finished bathing the dog, and I told my husband, and I was sitting in the living room and kind of, massaging in between my intercostal muscles, and that wasn't seeming to help. And it didn't feel like I was having a hard time palpitating the rib because it was up underneath my breast, so it wasn't easy. Then I was trying to basically apply some traction by grabbing underneath my ribs, under the cartilage, to see if that could stretch out and let that rib kind of settle back in. It didn't seem to work, but it wasn't horrible. So I rested a little bit, and then I went and washed Luna, no problem, leaning over the bathtub, everything's fine. So that was Sunday. Then Monday is hurting a little bit more. And I mean, you have to understand that my pain tolerance, my 0 to 10 would be someone's 0 to 300. I have an incredibly high pain tolerance. The only time I've ever passed out from pain is actually when I woke up in the middle of a surgery. So that's saying something. I live on Tylenol 3 at this point. And I want to add that in a couple weeks here. I'm actually having a spinal fusion, L4 through S1. And hopefully that'll decompress my spinal cord enough that I can feel my legs again and not have as much pain in my back. So I went to work Monday, and it just was getting worse throughout the day, but I was like, it hurts sometimes after a rib moves. If it doesn't go back into place, it's rather painful. So I went home, ended up putting lidoderm patches as much as I could underneath, because it was hurting. And, lidoderm patches help with numbing that kind of surface pain. And I thought if I can get that sort of numbed out, that maybe, sorry, detangler spray. I was like, if I could get that calmed down, get that muscle kind of relaxed a little bit, then it would stop. Well, as the night went on, it hurt more and more, even with a lidocaine patch, even taking Tylenol 3, double doses of Tylenol 3 and Motrin and Ultram and the Flexeril, and I was still hurting really, really bad. But as time was going on, it was getting painful to breathe. I wouldn't say harder, it hurt. But I'm like, sometimes it hurts if if a rib gets twisted or if it pops slightly out of place, that hurts. They're flat, long bones. So it was I think my husband said it was 11:30. I was like, listen, I'm going to go to the ER. And I'm going to get an x-ray just in case, but it's probably just dislocated really bad. I just can't get it back into place. So I get to the ER, and mind you, it's our little local ER, not like the big trauma hospital in the next town over. But they're really well. They know me. They know my Ehlers-Danlos. It's all in, my primary care physician actually used to be attached to the hospital. He's still with the hospital system, but he's at a different practice. But all my specialists, for the most part, are through this hospital system. So, that's where I like to go there. And it wasn't like it wasn't a big deal. Like, I dislocated a rib, right? So I get in, they took me right back, which is cool. But when I got in, I noticed there's like patients on cots in the hallway. I don't think I've ever seen that before. I think maybe like in the height of COVID, like right in the beginning, I went in, and it was like that, where they were in the hallway, and it had been, we've been hit pretty bad locally with it, so it made sense. But, you know, there's patients in the hallway. I'm just kind of like, ooh, you know, they're having a busy day. I didn't realize it was a full moon that night. I did look it up later. It was a full moon, which anybody in emergency medicine knows that means shit hits the fan. But the tech, I don't know if he was a nurse or just like a paramedic or whatever. He had to have been at minimum a paramedic, because he did end up giving me a shot of Dilaudid. But he was like, why are you here? And I'm like, well, to explain, I was like, I think I dislocated a rib, but the pain's getting worse, going up my sternum, so I just need an x-ray just to make sure I didn't break a rib. And he's all like, so have you taken anything for pain? I was like, yep, I took ibuprofen, Tylenol 3, Ultram, and Flexeril, and I have lidocaine patches on. He looks at me and goes, so why are you here? What do you think we're going to do for you? I was like, you're a fucking asshole, dude. And I'm like, well, I need to know if it's broken or not. He goes, well, it doesn't matter if it is. Yeah, the fuck it matters. Because your lung tissue, if it's a broken rib and it's displaced, you have that rough edge, and your rib's constantly moving when you breathe, rubbing on very fragile lung tissue. Like, literally, we're talking about tissue paper thin lung tissue. If that ruptures, tension pneumothorax, you could die. So, anyways, they take me back and they put me in a room, which I was kind of grateful I didn't have to be out in the hallway. But, like, didn't put me in a gown. I wasn't going to complain. I hate hospital gowns with every fiber of my being. To the point when I have my surgery, I already have hospital pajamas that I'm going to wear, even though they're like, you're only going to be in your gown. No, I will be out of that thing as soon as possible. I hate those things. Anyways, so he comes back in, and they need to do a 12-lead EKG on me. And I'm like, okay, you know, not telling this guy my background in medicine, right? Because I'm hurting. I had some knitting with me, had my AirPods. I don't know if I was watching, I don't remember. It was a lot. I was in pain. But you know, he lays me back on the bed, right? Well, he doesn't even tell me he's doing a 12 lead. He literally starts putting his hand up my shirt. Okay? I have been sexually assaulted multiple times by different people. You don't fucking do that. I don't care if it's a female doing it to a female patient. You don't do it without telling them, this is what I'm doing, this is why I'm doing it, this is where I'm going to place it. So he just sticks his hand straight up my shirt. I try to, like, move my shirt, you know, because my boob is heavy, and I know it's in the way. And he's like, put your hands at your side. He's like, leave your hands down. And I'm like, oh, okay. Then he sticks his hand down the top of my shirt to fish the lead up, not telling me what he's doing. And then he grabs for the waistband of my pants. If you've been sexually assaulted and you've had someone try to forcefully take your clothes off of you, then you know that feeling. And he didn't get it on the first try. He did it like 3 or 4 times. Because he had to move my waistband down like that much, right? And he's literally manhandling me, not telling me what he's doing. And I'm kind of like, why the fuck are you doing that? Put it on my ankles. But I was not. I mean, I literally was like frozen. Okay, that went a lot better. The first time I absolutely like lost it. And then this afternoon when I talked to my therapist, I got angry. So, okay, I didn't break down. Anyways, so that was horrible. He didn't tell me what he was doing at all. And I literally was frozen until he walked away. And then it was just like, what the fuck? Then the doctor came in and did an exam. And he was like, I need to touch your ribs. I'm like, okay. And he was like, ooh, yeah, that's a lot of pain. He's like, you should not be hurting that much. He goes, we're going to get you some pain meds, we're going to get some x-rays. And he was like, how do you do with morphine? And I'm like, I'll take it. I said, it'll make my face itchy, but... And he was like, oh, well, you have ALS. I'm like, yeah. He's like, I have mastocytosis. He's like, okay, so we're going to do Dilaudid because morphine has a higher histamine, is a high histamine drug, so it will make me itchy. And we don't want that happening when I'm already having trouble breathing. So he wanted to give me like a full milligram of Dilaudid. I'm like, no, we're not doing that. I'm like, can we start with half, like a quarter, half? Like, I don't want that much. I don't need to be completely worked out of my brain. I just want to be comfortable. And so he was okay with that. And then they take me down to x-ray. And that was an experience. That hurt. And then we come back and I had called I had to go to the bathroom at one point and I had to be disconnected. And they sent a woman in, which was really nice. And she's like, oh, we're just going to unplug you from the machine because it was different than what I'm used to, where you can unplug it at a port or at like a point, not at the machine. I wasn't just going to start unplugging shit because I just wasn't going to, and I couldn't reach up that high. Anyways, so the doctor they send the guy in, and he has like Dilaudid. He's like, did they tell you what it said? And I'm like, no, I haven't seen the doctor yet. He's like, oh, you broke 2 ribs. He's like, can I have your Dilaudid for you? I just want to be like, motherfucker, I told you. Sitting there, what do you think we're going to do for you? Fucking 2 broken ribs. 2 broken fucking ribs. Well, the doctor comes in, and I was like, yeah, apparently I broke 2 ribs. And he's like, yeah, well, I was like, what ribs are they? He's like, 4 and 5. So those are low, which is an explanation, at least understandable. Then he's like, well, at the base of your lungs, you have these little sacs called the alveoli, which are the little basically balloons that inflate when you breathe in, and it's where the blood and the CO2 exchange happens in your lungs. And he's like, yeah, your left side is partially collapsed. So not only did I break 2 ribs, I have a partially collapsed lung. And he brings out the whole inspirometer thing. If you don't know what that is, you'll learn about it in the future here when I have my fusion, because I'll have to use one, and I hate those things. I hate them. I've had to use them like my whole life, being an asthmatic kid and in and out of the hospital. I hate those things. But I was like, nope, I'm not doing that. I was like, I'm gonna have to have one in a couple of weeks. I'm not doing it now. I'll just do my deep breathing. And he's like, okay. So that was Monday, early Tuesday morning, and I had my husband had to come pick me up because I had Dilaudid. They gave me a Norco 10 before I left, and then he sent in some to the pharmacy for me to have at home. And so maybe I left my husband's truck up there. Anyways, I get home and husband takes my car in, and I was planning on going to work, but by the time the pharmacy opened, and I had my mother-in-law go get it for me. I love her. She's a saint. So she went and got the medicine for me. And then I had to take some to start getting the pain under control. And I was like, yeah, I don't think I'm coming into work today. Well, now we're a week after, and it's Monday night again, and I didn't go to work today. I did text my boss, and I was kind of like, my plan is to go into work on Monday. It didn't happen. It still hurts. Breathing doesn't hurt, but moving does. The weight of my boob is a lot, so moving around hits right on that where it's broken. And the pressure is mildly displaced, so like a little bit, not bad. I can feel it clunking around when I breathe. It's gross, but it's still sore. The reason why I'm documenting this is my therapist has been telling me for a couple of years, I need to share my story. So this is just one portion of it. I did call the hospital the next day, Tuesday, and couldn't get through to anyone at HR. I don't know who else to talk to because they don't have like customer relations or whatever at this hospital. So I couldn't get through to an HR person, and it was something that needed to be addressed immediately. I don't know if this person's working. This guy's going to be working that next night, but it can't happen what he did. It cannot happen again to another patient that maybe is not psychologically able to handle that like I can. I've been doing tons of trauma therapy for years now. So someone may not be as well equipped emotionally to handle that situation as I am sometimes able to handle it. So I ended up calling the operator, and I was like, I don't know who I need to talk to, whoever's in charge of like supervising the nurses or whatever, specifically for the ER. And I told the lady, and she was like, are you okay? And I'm like, I'll be fine. After, like, I'm having a hard time breathing, and and not from my ribs. It triggers my PTSD quite a bit. And she was like, do we need to call someone for you? Or I was like, nope, I'm okay. I was like, I'll be fine. I'll talk to my therapist about it next week or whatever. Because my therapist had a colonoscopy or something, so we missed last week, which it was fine. I was not in any right state of mind mentally, with the pain meds to be able to have any meaningful therapy. But I called my husband and I told him, and he was like, are you okay? I was like, yep, I'll be fine. I'm okay. It had to be said. And the head of the nurses was really like, oh my gosh, it never should happen. And I'm like, yeah, it's like, that's consent, informed consent, and communication. Vitally important for everyone, but especially in emergency situations, because you're literally there sometimes on the worst moment of your life. And yeah, so I don't know if that guy works there anymore. Honestly, I'm afraid if I have to go back to the ER there and he's working, how am I going to get treated if he is, because it's a small ER, so they have one nurse, then they have the one doctor, they have one tech. I mean, tiny little community, small ER. I think it has 6 beds or something. So yeah, it's I'm nervous if I have to go back, especially after my surgery. What if something goes wrong after I come home and I can't make it the hour-and-a-half drive to the big university hospital like they want me to? What if I can't? What if I fall and I have to go and I end up having to go to that hospital first just for triage, and he's there? I shouldn't have to worry about that. No one should. No, he's not the one that assaulted me. It doesn't matter. It was the motion, the thumbing, trying to pull my pants down. And I did talk to my therapist about this today, and I got angry today. Because now, so what if I fall and re-break my ribs? I have to go back. In the next couple of weeks. Is he going to be there? Are they all going to be like, oh, it's that one, the girl with broken ribs that called and complained? So do I get shitty service now? I don't know. I shouldn't have to worry about it. But I do. I shouldn't have to. If you know a physician, a nurse, a tech, EMT, paramedic, share this with them, please. Because they need to be aware of the impact that their actions can have on a patient. Just do better.